Imagine a 52-year-old woman named Jane. She's been experiencing a lot of belly pain and it's getting worse. Now initially she thought it was indigestion, something she had eaten, but the pain's really getting worse and it's moving kind of down low below her belly button and off to the left. She's also starting to feel sick to her stomach and she's noticed some changes in her bowel habits. She's starting to have some diarrhea. She's getting concerned. So she goes to the urgent care. At the urgent care, she sees a provider who listens carefully to what she says. And as Jane describes the symptoms, the doctor performs a physical exam, pressing gently on her belly. When he presses down in that left lower part of her abdomen, Jane winces in pain, and the doctor thinks Jane might have diverticulitis. To confirm it, he sends her to an imaging center for a CAT scan, and the results come back pretty quick. Jane has diverticulitis, and the doctor seems really pleased that he made the diagnosis, and he's pleased because he tells Jane it's diverticulitis, but that's okay because it's simple diverticulitis. And Jane says to herself, is that good? What does that mean, simple diverticulitis? And how am I going to be treated? Well, that's what today's video is about. Hi, I'm Dr. Brian. What is diverticulitis? What does it mean if you have a simple or complicated diverticulitis? And if diverticulitis is diagnosed, how is it treated? What can you expect? Diverticulitis is a condition where small pouches or diverticula develop in the colon, and these become inflamed or infected. Diverticulitis can then be categorized into two different divisions: simple or complicated diverticulitis. Now, the distinction between these two is critical because it changes the way the treatment is approached. So what's simple diverticulitis? This is by far the most common form of diverticulitis, and it's what Jane has. It's characterized by very localized inflammation without any complications. The symptoms include abdominal pain, fever, changes in your bowel habits like diarrhea, but there really aren't any signs of more serious problems. Problems like abscesses where there's collections of pus or larger infections. There's not what are called fistulas. Fistulas are where there's abnormal connections between bowel and other parts of your body that's caused by the infection. There's no perforations, that is holes where bacteria are leaking out of the colon into the surrounding area. And there's no obstructions, that is the bowel is still passing material through it just like it's supposed to. So simple diverticulitis can often be managed with outpatient treatment, and most patients recover fully with appropriate care. Let's contrast that with complicated diverticulitis. That, on the other hand, involves more severe issues like abscess formation. That's when you get a collection of pus, of infection, and it can be right next to the bowel, or it can even be in other places like the liver. You can get fistulas. That's where infection connects a piece of bowel to another piece of bowel, or a piece of bowel to your bladder, or a piece of bowel to the gallbladder. Also, in complicated diverticulitis, you can get perforation. Remember, you have trillions of bacteria in your colon. Just a few of those, if they leak out through a hole and get into the rest of your abdomen, can cause tremendous trouble. Finally, bowel obstruction. The inflammation from diverticulitis, if it's in a simple case, is just a small area in the wall of the colon. But in complicated diverticulitis, the entire circle or circumference of the wall of the colon can get really big and swollen. That can block up the entire intestine, so nothing can pass through it. It's like having a dam in the stream, so everything upstream gets big, distended, and that can really be a problem and only relieved by surgery sometimes. So it's really important to figure out whether you have simple or complicated diverticulitis. But once you do, what's the treatment? Well, Jane has already been diagnosed with simple diverticulitis, and the doctor at the urgent care says you can go home, take antibiotics or pills by mouth, and that should take care of it. And there's very good evidence that if you have simple diverticulitis, you don't need to come into the hospital. You do very well by going home and taking pills. And in some areas of Europe, they don't even give the pills. Usually the antibiotics are specifically focused on special kinds of bacteria that cause the infection in diverticulitis. Other components of treatment for Jane is she wants to change her diet a little bit, at least until her bowel heals. She does low fiber, she does clear liquid, and then she gradually reintroduces more solid foods until she starts to feel normal. And then eventually when she's healed, she actually ups her fiber intake. And that will help prevent future episodes by softening her stool and reducing pressure on the colon. While she's getting better, there's pain management, and usually this is over the counter, like Tylenol. Things that thin your blood, like ibuprofen or aspirin, that's usually not used because every once in a while diverticulitis can also cause bleeding. Now let's consider the case where it's not simple like Jane, but it's complicated. The treatment really depends on the complication, and that's usually diagnosed by CAT scan. Treatment is usually hospitalization, not outpatient, and particularly if there's any of those complications we talked about, abscess, perforation, or bowel obstruction. In that case, Jane would have been admitted to the hospital for close monitoring and more aggressive treatment. Number one, instead of antibiotics that are by mouth, when you have complicated diverticulitis, the antibiotics go IV, that is in the veins or into the blood vessels. These are stronger, they act more quickly, and again, they target the infection more effectively than if you take it by mouth. If the CAT scan identifies an abscess, one of those pockets of pus, there are a couple different options. Sometimes these can be fixed or drained in what is known as a non-invasive way, oftentimes by an interventional radiologist. They use a catheter or a needle, and they use CAT scan and ultrasound, and are able to drain that infection without doing an open surgery. Sometimes the infection is so bad or located in a position that you just can't get to it very easily, and somebody has to have open surgery. In cases when there's a complication that just can't be treated by the antibiotics, there are a number of surgical options that may be required. One is bowel resection. That's where a portion of the bowel is cut out and the two ends of the bowel are connected back together. And in some cases, the bowel can't be connected back together and you have to have what's called a colostomy. That's where a piece of the bowel is taken out, but the end of the bowel actually goes to the front part of the abdomen or the belly and empties into a bag. So whether you have simple or complicated diverticulitis, once you recover, there are a number of different things that you can do to change or help so you don't have recurrence. One is a high fiber diet. That will soften your stool, reduce pressure in the colon, and lowers the risk of additional diverticulitis episodes. Regular exercise. There's good evidence that engaging in regular physical activity, which will also maintain bowel regularity and overall digestive health, can reduce the risk of diverticulitis. Smoking. There's good evidence that smoking is a risk factor for diverticulitis. Weight management. A healthy weight can really help reduce the strain on the colon and decreases the likelihood of developing diverticulitis. That's diverticulitis. Thanks for watching. And if you'd like to see other videos, try this one on lactose intolerance or this one on diverticulosis. And please don't forget to hit subscribe.